definitely does impact the health of the population in Nebraska because we just offer services that otherwise people probably wouldn't get. A lot of times, you know, if they're on our Every Woman Matters screening program, they say, well, this is the only time I go to the doctor. It's just every, you know, few years for my Every Woman Matters exam.
The refugees, when they come here, to make sure we don't have refugees that have communicable disease and are out and about. But we also, the focus is to make sure refugees are healthy and successful once they get here. We want them to become self-sufficient, get jobs, be in school. So we try and help with the overall health. We have a health promotion grant where we do health education. And then our health screening is a big piece, is making sure they're healthy to be out and about and keep on going on with what they need to do to be successful here in the U.S.
With PASSAR, the reason that it is done is because people who have mental illness, intellectual disabilities, developmental disabilities won't be institutionalized. That we find community services for individuals that may have some medical needs, but can be better served in the community in a less restrictive environment. And so I think that improves health for a lot of individuals when they're able to stay in their community and thrive in their community. And
we train them to go out in the population and, you know, teach one-on-one or as a group effort the different reasons that people should get screenings. And
but the Women's Health Advisory Council identified 5 areas, new areas to focus on, and that's health equity, sexual health, preconception health, nutrition and healthy weight gain, advanced care directives, which will probably move to something different because we've kind of played out what we wanted to do with, and the we have health care of the woman that's over 65, you know, those health issues, and then mental health. So, and then in our office, we continue to prioritize breastfeeding as a preventative practice and encourage women and work with real closely with the Breastfeeding Coalition and their
I work closely with the immunization program with Rebecca Martinez because vaccinations are a big piece. Refugees don't need any vaccines to come here to the U.S., so we want to get people up to par where they need to be. And then we work with a variety of the health programs with our local health departments to make sure that refugees are included in those goals for population health. And of course work with different issues. Right now we just submitted a grant through Community Health Endowment to focus on mental health needs here in Lincoln. We have the large GCD population which has come here, which has very significant mental health needs. So we're looking at training therapists, doing some more peer support options, and training interpreters because there's a great need for that type of help and training providers in the area. So I'm excited to hear back about that at the end of the month.
And I think that helped Medicaid because Dee Dee had done all of that pricing and service definitions. And so it really was, you know, at first people didn't want to come to the table, I think because they didn't know how to contribute and not have a huge conflict of interest. And now we work as a team to figure out how we can do it better, more efficiently together. And sometimes we pool our resources, and sometimes there's things that can be done for the population that Medicaid doesn't have to pay for, but could provide as a specialized services. So specialized services don't have to be just those things that you have to pay money for, but could most certainly be recommended for them to have an optimal life.
I think that's something that gets a little bit lost sometimes is, you know, we make health a shared value, we epitomize health and everybody should be healthy, and sometimes we sort of forget about the disabilities community. Or, you know, we obviously want everyone to be healthy, but we don't want to make it look like anybody is substandard because they do have either, you know, chronic conditions or disability or something like that.
Mm-hmm.
You know, and I honestly wish that public health wouldn't be quite so snobby about that, frankly. We have to think about people that don't have the same bodies as we do.
Mm-hmm.
And we can't be making these blanket statements for them, you know, and we have to think about families as well, you know, mothers of children with disabilities and things like that, and what, you know, what their specific health needs are, which might not be our goals for them. Maybe they have something else. I talked to them more, almost like how they say with a doctor-patient, with more shared decision-making instead of public health says, this is what you need to do. Therefore, you need to listen to us. No, what are your needs specifically in your community? Is it that you need a grocery store with more fruits and vegetables? Is that what you need, or is that what public health wants for you? And you actually want something else entirely, because we shouldn't be telling other people necessarily what's best for them. I mean, how arrogant is that?
Yeah.
For me, is health being something that will make everyone else better. So again, if the mom is healthy, then her children will be healthier, even when she's pregnant, and then she can stay healthier to take care of them if they're not, and for her family. And then if those children are healthier, then they'll have a better education. You know, they'll be at school more, let's say, and then they'll be able to learn better if they're well fed and they're not sick. And then they'll grow up and be healthier people. And so I think the idea that health of an individual always then transcends, because we don't live alone, to the health of everyone in their family, health in your community, health of your neighbors, health of your coworkers. Then I don't have to do as much work. If she's working with me, then I don't have to work as hard because she's healthy, she's doing her job. And so I think that if people could just adopt that and understand that it's not about my health or even the health of my family. It's about the health of my entire family, my teachers, my coworkers. And if I can help them get healthy, if I can do something to help them be healthy, then it's going to affect the city, the state, the country.